Hello. Welcome to the Massachusetts General Hospital Frontal Temporal Disorders Unit Community Forum Friday session, Connections for Care, Accessing Resources for Dementia Care and Caregiver Support. My name is Brandt. I'm the Director of Caregiver Support Services and Public Relations for the MGH FTD unit. I'm thrilled to continue to bring this series to provide information that's relevant to your life as an individual, caregiver, or family living life with a dementia diagnosis. Please remember that you can find recordings for all of our sessions on our MGH FTD unit YouTube channel, and that for today's session, we are happy to take questions. You can just type them into the question and answer box at the bottom of your Zoom screen. Today, I am thrilled to be joined by Lynn Vidler and Liz Bradley so that we can talk about what are the resources and supports available across the state of Massachusetts for families. I'd love to introduce both of them now. Lynn Vidler is the Director of Home and Community-Based Programs at the Executive Office of Elder Affairs. Elder Affairs supports older adults and individuals with disabilities to age in community so that they can live well and be safe. So important. They provide access to quality aging and disability services through a partnership with 26 regional nonprofit elder service agencies throughout the state, and we're going to learn more about that today. Elder Affairs promotes independence, empowerment, and well-being for older people, individuals with disabilities, and their families. They ensure access to the resources you need to live healthy in every community in the Commonwealth. For over 30 years, Lynn has dedicated her professional and personal life to advancing aging, elder care, and integrating person-centered perspectives and quality in-home care. And Lynn's going to bring all of that passion to our session today. We're also joined by Liz Bradley. Liz Bradley is the PACE manager for the Office of Long-Term Services and Supports and works with the Integrated Care Team, which includes senior care options and One Care. Liz has been in this position for 8 years, and she's also worked as a dietitian in some of Boston's PACE programs. Liz brings her experience working with families on the ground in PACE programs and with CMS regarding PACE issues to her work every day. And I want to let you know that Liz is bringing her passion about her love for the PACE program to our session today. Lynn and Liz, welcome.
Thank you.
You know, this is such an important topic for our families because many people know that the MGH FTD unit cares for individuals living with atypical and young onset neurological disorders, many of which cause dementia at younger ages. And so I think that in our community, sometimes we forget that there are services that you might typically think of, oh, those are only available for seniors, but actually our families can benefit from those programs as well. So Lynn, I thought that it would be great if we started our session off with you so that you could talk about the larger framework of programs and services available across the Commonwealth.
Great. Thank you so much, Katie. I am actually honored to even be invited to speak with you on this forum Friday and actually be with all of your attendees, either here today or future on your YouTube channel. I believe in this work that we do, and I really am proud of the fact that we keep evolving in how we care for loved ones in the community. So let me just start off by saying that I am excited to be here, and really Elder Affairs, although the name is Executive Office of Elder Affairs, and you hear the terms like elder or senior, really what we're all about is aging in place, and aging safely. And as you mentioned, Elder Affairs is really about independence and empowerment, but not just of older adults. It's also individuals with disabilities and the people that are taking care of them. So I know we were going to start off with talking about what's called an ASAP, and here's the alphabet soup for us today. So ASAP is Aging Services Access Point. And really, when you break it down, aging services. So we're talking about an organization that has a lot of history in working in this population setting and with those that are also possibly aging with a disability and aging into now our services. But the Aging Services Access Point is this regional organization that has a history of working with individuals and providing them community resources in a variety of different ways. So we always break it down and say aging services, it's those services for individuals that are aging, and then the access point is a single centralized kind of location where you can get the information that you need. So what we see in front of us is a map of the Commonwealth, and every shaded area that differs in color identifies a region. And that region in particular has a ASAP, or Aging Services Access Point organization. And their goal is to really meet the needs of their community. Now, as you mentioned, there is a full, robust number across the state. And we also have what's called area agencies on aging. And they either are contained within the ASAP, or they have a partnership with an organization that has this title in their area. Their main goal between the two of them is to really provide care and resources to people in their community, and it's really at the local level. So Elder Affairs does contract with them. It is a specific and unique organization to that geographic territory. There is no overlapping. And what you can think of is that they offer services, resources, programs to meet the needs of many. And it really isn't just about somebody that has the label, if you will, of senior. It's somebody that's aging across the spectrum. So I wanted to talk about maybe 5 of the bigger programs first, just to give you an idea of what's available. And because they contract with the Executive Office of Elder Affairs and we're a state agency, when they're providing care, they're either providing the care at a no cost or a low to moderate cost. And this is really important because in today's technology and information that's out there, there is so much to try and discern as far as, is there a cost associated with it? What is the cost? You know, is this a for-profit entity, a nonprofit entity, a government agency? Like really all of that kind of information. So ASAPs are nonprofits, Aging Services Access Points, and the information that you can get for them is either going to be at a no cost, or services may be no cost or low cost. And that's important because you want to know up front if you have to expend any of your own resources. So 5 big programs or services that you could possibly access. This is not a full list. There are so many others, but I just wanted to give you kind of like a taste, an appetizer of other things that you might actually be able to learn from the organizations. So first and foremost, information and resources. This is available to anyone. You can call any ASAP and you can actually just ask, hey, do you have any community resources that could, and fill in the blank. It could be something as simple as hairdressers that come to the home. It could be maybe an organization that provides free medical equipment. It could be snow shoveling resources, or it could even be something like Social Security or Medicare insurance help. Another main program that is available is nutrition. And we typically talk about food securities and nutrition. One of the main services you might hear about is home delivered meals or Meals on Wheels. Now, they're available all across the Commonwealth. And the ASAPs and the AAAs specifically, sorry, I didn't define AAA, Area Agency on Aging. It's not the auto insurance. So the AAAs and the ASAPs, they provide nutrition and food security programs like home delivered meals. Now, in both information and resource program, as well as the nutrition program, there's some that could be a no cost. So information and referral is no cost to anyone. Anyone can call. You can call if you're 20 years old, you could call if you're 40 years old. And it doesn't just have to be asking for a resource that might serve somebody that is over 60. It could also be under 60 as well. Could be somebody that's 22, but that has a disability. The food security programs are going to vary. Some require a contribution, and it might be income-based. But home delivered meals in particular, that's actually a federal program in which it's donation-based. And you might think, well, I'm not over the age of 60, and my loved one, who I'm caring for, is not over the age of 60. But some of these organizations have programs that'll actually serve individuals with a disability that's under. So it's always best to call. The other three programs I just want to touch upon, one has to do with mental health and behavioral health. Now, we know that there's resources across the state, but there's not enough. And one option for you to do is to call the ASAP to find out what's available in your community. Now, behavioral health and mental health resources could be evidence-based programs, it could be peer support specialists, and these are people that have lived experience with some sort of behavioral health or mental health condition, and they're successful and they want to share that success with others so that they can actually stabilize their own life, as well as possibly what we're calling elder mental health programs, and the acronym for that is MHOT. There are community programs that are out there for you, and it is not always dependent on age. It's really more dependent on the community itself. The last two in particular are family caregiver support and then home care. The Massachusetts Family Caregiver Support Program is specifically geared towards helping caregivers. So the person that we're trying to assist, the person that we're trying to provide care to, self-care, support, coping mechanisms, tips, is the caregiver. And this could be in the form of face-to-face meetings, whether it's in person, socially distanced right now due to COVID, or possibly virtual, or it could be possibly through a support group, once again, virtual, remote, or it could be in the sense of written materials, let's say, after a conversation with trying to figure out a way to maybe deal with a behavior that is exhibiting now with somebody that you are caring for, based on their own, based on their own dementia, they can actually provide you a written summary and tips and send that out to you so that you can read and then digest it and then have conversations later. So the resources within the Family Caregiver Support Program are actually quite robust, but are tailored to that caregiving relationship. The last program that Katie actually had talked to me about that might be beneficial to those of you that are either listening or watching at a later date is what we call home care. The home care program has been around for several decades, and over the decades it evolves. And one of the proudest evolutions that we have actually made within the home care program has to do with who is potentially eligible. Now, there are 5 markers of eligibility, and the first one is age. And you might be sitting there and thinking, well, I am caring for a loved one who is younger, and therefore they wouldn't qualify. But that's actually not necessarily the case. So we do have an age of 60 years and older for somebody who could qualify for the program. However, several years ago, there was an addition into our eligibility guideline, and it was for the modification of somebody who is under the age of 60 with a dementia or Alzheimer's diagnosis could qualify. This is really important. I will tell you that as we learn more about dementias and different types of diagnoses. Their names evolve. 20 years ago, let me just share that when I was working in the home care program early on in the state, I worked with somebody who was age 42, and at the time, she was diagnosed with what's called Pick's disease. We do know that now that is not necessarily the term that's typically referred to. Once again, 2 decades ago, that's what it was called. 42 years old, and she had this dementia diagnosis, and we were helping her in the home care program. So under the age of 60, with a dementia will qualify. You do not need medical proof, okay? So please know, you do not have to substantiate with a doctor's order or any kind of medical proof. That is not the basis of the program. The basis of the program is to not only help the individual that needs the help, but also that caregiver who also needs some support to really maintain that caregiving role that exists. So there are a couple other eligibility criteria, and one is residence. All this means is you contact the actual ASAP, Aging Services Access Point, in your area, and they're the ones that are going to serve you. So it's not like picking and choosing throughout the state. It's wherever you live or wherever your loved one lives, that's the organization that will serve you. That's all residence means. Another item is called income. Now, this is another great evolution of the program. Income is only an indicator for the contributions that the family may participate in for the cost of services. So it might even be no cost at all. It could be a moderate or low monthly flat fee, or it could be a percent-based fee. But income only is a marker of kind of what contribution the individual or the family might make. It is not a restriction, as in if you make over a certain dollar amount, then you can't receive services. That doesn't exist anymore, and that's one of the great modifications that was made to the program several years ago. The last 2 eligibility criteria really have to do with somebody's ability to function and complete tasks in the home and what's needed. So as an example, we talk about things like activities of daily living. These are bathing, dressing, getting on and off a toilet, transferring, getting up and down out of a chair. Those are what we call the activities of daily living. So we look at those. What does the person need help with? And we also look at their support system, their caregiver, who's available to assist on a daily basis, and what else is needed. So the last one is called need, and this kind of flows directly with the functional needs that the person has. And really what this means is we look at the whole picture of the person that needs care and then their supports, their informal supports, like you, a caregiver. And we say, okay, what's available? What is it that the person or the caregiver is truly needing? And I just want to talk for a brief minute about something that's really important. And the term kind of has different meanings depending on who you're talking to. So when we look at services within home care, we can provide assistance with certain functions within the home. Now, one person who is caregiving for an individual really might just need laundry help, right? They just need somebody to help take care of their laundry. That's the only thing. And if they had assistance with just taking care of the laundry, things would be so much easier that it would present a much more satisfying kind of caregiving environment. And it's just because maybe there's a lot of laundry because the individual might have accidents on occasion. So laundry is a service that home care can help with. Now, when you put it in the context of a benefit to both the caregiver and the individual, really what that means is it's providing respite or relief. We use the term of respite to be really relief of that caregiving relationship. For every caregiving relationship, it is going to be unique and different for that relationship. So one person might need laundry assistance, and that can be provided. Another caregiving relationship, maybe it's all about self-care and ensuring that the caregiver can actually leave the home. Maybe they are going to take an hour or 2 hours at a local park to enjoy the outside environment. Maybe they're going to use that time to do errands, because doing errands actually helps with organizing the day and having the ability to kind of work through some of the things that need to be done, those tasks. Or it could be maybe that a caregiver needs to go and get their hair done, whether it is a style at a barbershop or at a salon. But those are all important because it's about self-care and being able to take care of what you need to take care of, but yet do so in a way where you know that your loved one is well taken care of. So maybe what's needed is a companion, somebody that can come into the home, sit. Maybe it's watch TV, Wheel of Fortune, because that's the show that brings the most enjoyment. Maybe it's playing cards. Maybe it's talking about baseball and baseball cards. Whatever that interaction is, the companion could provide it. So for that caregiving relationship, a companion would be most suited. That's also respite. It's relief. So when we talk about what really is needed from a respite perspective, a way to provide relief so that the caregiver can really take on the lion's share of the other responsibilities that maybe can't be provided by an external service, that's okay. And that's what we mean by respite. It's really what is needed to really make that caregiving relationship successful, because we know that caregivers actually provide the bulk, the lion's share of the work, and maybe having somebody else take a certain portion or chunk that isn't as maybe relied on by the caregiver, and that makes all the difference in the world. There's other services that are available. Home delivered meals, I already mentioned, so that's one option. We also have services, you may have heard the term Lifeline or Personal Emergency Response System. There's one in particular that has a falls detection. So if the person you're caregiving has a dementia that also impacts their balance and their ability to walk, their gait, you might want a falls detection personal emergency response, in which if the person has a sudden movement, it would actually alert that there could be a fall occurring in that environment. So that's another type of service. Right now during COVID, there's 2 other services, but they're not widely used. But we do anticipate that we're all going to be coming through COVID, and we're going to be a lot stronger. And those 2 other services that are not highly utilized now, but will be, and I just want to mention this because there will be a time coming in which they could be fully available to you, is Adult Day Health and Supportive Day. Supportive Day really is a caregiving site-based location in which individuals can attend half day or a full day and receive oversight and cueing and direction and the activities that actually engage an individual with, a variety of different kind of projects. People are trained, people are actually able to provide, maybe crafts or activities such as billiards, things of that nature. The more medical model is called Adult Day Health. And we do see more Adult Day Health opening right now under phase 3 of COVID. So they could be functional in your community right now, but we do know that some of them are still closed. It provides the same kind of interaction that Supportive Day does, but it's a medical-based model, so there's more hands-on care. And that really is the difference. Supportive Day would be more for somebody that is able to really function, but they need oversight and cueing, right? Direction, make sure that they're safe, where the medical model is going to provide more hands-on, assist with transferring, toileting, things of that nature. Other kinds of services might be homemaking. This is help in the home, cleaning up, could be grocery shopping, making sure that you get groceries in the home. And then we also have services that help with bathing, dressing, as well as incontinence management. Now, for the caregiving relationship and somebody that has dementia, one of the things that we also provide is we take somebody that is an in-home worker, trained as a personal care worker who will come and assist with bathing and dressing. We've given them additional training, and they are called a supportive home care aide. A supportive home care aide is somebody that has additional training in dementia. They are somebody that has learned how to redirect. They are somebody that has been trained on how to de-escalate certain behaviors that are related to dementia. So in certain instances, instead of someone that has just bathing and dressing kind of training, the individual has an additional layer of training to really work with people that have dementia. And this is an available service within home care too. There are many more. There's over 49. I'm not going to tell you all of them today because that would just kind of overwhelm you. And I don't want to do that. What I hope is that today you will take away with the fact that there are resources out in the community, in your local city and town, that you can reach out to and learn more about what's available for your caregiving relationship, possibly those that are older in your neighborhood. You have resources available. So what you are seeing on the screen is what's called Mass Options. This is the go-to. Mass Options is a toll-free number as well as a website. And when you go to Mass Options, you can search the website, you can call them directly, you can fill out a form. And really what this is to do is to put you in direct contact with that Aging Services Access Point and that area agency on aging. Sorry about that. I got tripped up this morning. So Mass Options will actually connect you with that local regional agency that has all this experience on resources in your city or town. And what I would ask for you to do is, if today is a great day and you don't need assistance today and you don't need care today, this is when you want to try and look up the information, right? All you need to do is find the area agency on aging or the Aging Services Access Point today. Call them and say, hey, I'm a caregiver. I need to know what's available in my community. You don't have to act on it today at all. Today's a great day. All this is information research. Think of it that way. So then maybe a week from now or 2 weeks from now, you really want to talk to somebody, you want to reach out, you want a better understanding, you already know who to call today. So the idea is to know who your Aging Services Access Point is today, and they all have different names. Some of them have the term elder in them, some of them don't. Berkshire County, it's Elder Services of Berkshire County. They have a wide geographic territory, but they are also historically well-versed in those individuals with disabilities also. So don't let the name fool you. But you want to reach out, you want to understand who it is that you can connect with, because there are a wide number of other programs that I didn't touch upon, and there's a wide number of services, and they do have something available for you, and understanding who they are and where they are ahead of time will be a great benefit. So when you really need them, you know where to go. So I would say to start, go to Mass Options and connect to find out who your Aging Services Access Point is as a first step. And just know that there are resources available for you in your city and town to help with caregiving. And Katie, I think I'm going to break there because I know I gave a lot of information and I don't want to overload people today on your Friday forum, but I want to thank you so much again for allowing this opportunity to kind of just share this intricate, rich, resource-dense network that's available to your participants and your attendees here. And thank you so much.
Lynn, that was a tour de force of the overview of programs. But what I could hear so clearly from you is, first of all, your passion. But what I loved were the small examples, validating that, let's say a caregiver would like to take 2 hours to walk in a park, that they would like to go to the grocery store and CVS alone, that they want to get their hair cut, that we value that those small activities are self-care, that they can provide respite from the daily, like as you said, lion's share of caregiving, and that that's a valid reason to call and ask for help. I think that caregivers sometimes think they need to be like, I'm going in for surgery, so I'm going to call and ask for help. You don't have to wait.
You know, and that's the thing is you don't have to wait, because maybe a year from now you are going to go into surgery, right? But wouldn't it be great to have connections now, right? Maybe you start off with a companion that can come in once every 2 weeks just to get familiar with your loved one. So then a year from now, when you do go in for surgery, it's not as big of a shock. It is much smoother and you almost can relax. Caregiving is rewarding, but it is also one of the most challenging things that we can do in our lives. And really, it's, you know, we talk about self-care, but it's really preservation of that loved one, because if you take care of yourself, then you can be better prepared in order to take care of that person that you love so much that you want to take care of, right? So a little bit of time over here for ourselves is not being selfish. It's actually being very generous to the person that you love. And that's really the heart of it, which I would hope that every caregiver knows, that they have the utmost respect of so many people because they're being so generous with their own lives and they're giving freely to that person that they love. So let us help you take care of you.
That's wonderful, Lynn. So the takeaways that I'm hearing from you today are that today is a good day to call to find out what is eligible, what's available to you, that regardless of your age, if you are a person living with a disability or a dementia diagnosis, services may be appropriate for you, and that there is a no pay, low pay, or moderate option for services so that people can really find out the cost of services before they embark on them. That's
Definitely.
wonderful. Thank you for that overview. So, you know, Lynn, I think you provided this overview so people could think about just what's the foundation of care available through the Office of Elder Affairs. And I asked Liz to join us as well, because there's one program in particular that we've had multiple patients benefit from, but I don't think that people widely understand what it is or how to access it. So Liz, I'm thrilled to welcome you today to help us understand more about the PACE program.
Okay. I'm thank you very much, Kate, for your introduction. And Lynn, that was great. I have worked with across the aisle, we call it, because we're all on the same floor at Ashburton. And I've worked for years with many of the home cares. And PACE also is one of those programs that Mass Options will refer individuals to, families to, if they need it. So on that note, thank you, Lynn, for your great presentation. And Katie, thank you for inviting me here today. I work for Mass Health, which is, as you know, the health insurer for the state of Massachusetts. And I am manager of a program called PACE, which stands for the Program of All-Inclusive Care for the Elders. So it is a medical model. We provide all the medical services and social services that somebody will need. I work in the Executive Office of Health and Human Services, and I work in the program called Integrated Care, which includes SCO and One Care and PACE. And that just means that all of your care, whether it's social services, medical care, are all blended together and taken care of by a team. So I'd like to move on to the next screen, if that's okay. So in Massachusetts, there are 8 providers, and further on there's a map and it shows you the areas they cover. There are 25 what we call PACE sites. Each PACE program has a center where all the services for an individual come out of. It's a very small program in Massachusetts because you have to be screened as nursing home level of care, and you still want to live in your community, which many people do. There's over 4,700 people in the program right now in Massachusetts, and access to your medical or social service provider is 24/7. So can we go on? So just give you a little bit of background on PACE. It's a Medicare, Medicaid program. A person who joins PACE can be Medicare eligible, Medicare and Medicaid eligible, just Medicaid eligible, or completely self-pay. And as I said, it provides an entire continuum of care services to our participants with chronic care needs who want to stay in their home, or their family wants to work with them. Some people have no family, and some people do have family and caregivers to work with. So, okay, next screen. So we're considered a community-based program, and we are in very specific service areas around the state. And we provide a complete range of healthcare services and social services to frail elders. We are, the PACE program itself is coordinated in an IDT, it's called, which is an interdisciplinary team. And the providers in that team are your doctors, your nurses, nurse practitioners, social worker, rehab therapists, home care workers, and many others. And I'll show you further on in this presentation who those people are. So next screen. We work in partnership with the participant and the caregivers, if there are caregivers, to design a very specific care plan that best meets the needs of each individual to keep them healthy, living in the community, and well supported. We deliver all medical, including hospitalizations, if you have to go into a nursing home for rehab, or if you have to go in at some point through the course of your life for long-term services. PACE is responsible for all of that and works with you and your family to coordinate all that. And we also, you have your own physician in the PACE program who works with about 100 people. So there's only 100 participants per physician in a PACE program. So you can get to be very familiar with that person, plus all the other caregivers in the PACE team. So next screen. So I mentioned an interdisciplinary team. So when a person decides they want to join PACE, this whole team usually meets with the participant and the family. So there's primary care physician, nurse and a nurse practitioner or a physician's assistant, social workers, physical therapists, occupational. In every one of our centers, there are recreational therapists and activities coordinators. It's run, the PACE Center is similar to an adult day health program, except it's much more broader. It's got a lot more services that it can offer. There's a dietitian, there's a center manager, and also on that team is a home care coordinator, because a lot of participants will need to have services in the home. You know, some people never come into the PACE Center because they can't. They physically can't leave their home. So PACE goes into the home with nurses, doctors, PT, OT, all kinds of equipment. There's also the PCA coordinator, and there's a transportation coordinator. PACE provides all the transportation to all the services it will provide to an individual who becomes a PACE member. Can we go to the next screen? Are we stuck? Okay. So this just shows you, it's just, there's a couple of these in here, there's 2, I think. It shows you for the PACE participant, surrounding them are all these members of the IDT team who will help develop a care plan and help execute it so that somebody can stay in their home safely. Okay, next one. So along with the members of the IDT team, these are services that can be provided by PACE. As you can see, there's primary care nursing, meals either at the site, delivered to your home through the Meals on Wheels program, working with the home cares, or some people actually take meals home from the center. There's all home care services. PACE provides all the prescription drugs and medications that a person needs. They also provide all the durable medical equipment that the team in the care planning decides a participant needs. They provide social services, or you have your own social worker who works with you to set up and work with you on any questions or issues or concerns that you have. We also provide all medical specialties somebody would need: audiology, dentistry, optometry, podiatry, and speech therapy. We have rehab care, and we will have respite care. Respite care can sometimes occur in a nursing home facility. Somebody's going away for 2 weeks, they're going to have surgery, like you said, Lynn. The PACE program itself will provide these services to keep that person safe in the home while their caregiver is away. So next screen. And this was designed by one of our clinical nurses. She retired 2 years ago, Phyllis, at the age of 95. She was the PACE clinical coordinator for the state. I worked with her for years. She was a wonderful, wonderful woman. And yeah, she loved PACE. She was so good. But she designed this, and she put in all the little programs and services that are available to people. So transportation, durable medical equipment, all your medications, specialty services. Behavioral health is a big part of the PACE program. PACE is a program, well, I'll talk about the eligibility when we get to that screen. So your hospital care, your rehab care, personal care at home, even at the site. PACE centers are developed that they can do, they can shower participants, they can do laundry at some of the centers. So all these services can be provided at the PACE center. If a person lives in a home where it's not easy for them to get into a shower or to do their laundry, those services can be provided by PACE, either in the home or at the PACE center. So as you can see, it starts with the frail elder in the center and their caregiver, if they have one, and then that PACE IDT team, and then the PACE center with all the other workers who help take care of this participant. Okay, next. So this is the eligibility I was talking about. In PACE, CMS has developed the regulations that the state follows. So you need to be 55 and older. We consider that the age of eligibility for PACE. You have to be nursing home certifiable, which means that the PACE program will go out to your family to talk to you and to fill out a medical and an enrollment form and discuss your level of care. And once they do that, they send this information into the state, and the state has a system and nurses who will review the enrollment. You need to live in the PACE service area, and we have a map later on. I'll show you where those service areas are, because the reason that PACE is limited to a service area is because an individual needs to be able to get into the PACE center for services. A lot of the time they come in for their doctor's appointments or other things. And so you don't want to be outside of a drivable service area. And that's why the CMS has always limited that. And you have to be able to live safely in the community at the time of enrollment. In order, because I work for Mass Health, I look at that Mass Health eligibility. You must be standard. Though in order to join PACE, you don't have to be Mass Health eligible. And if you're under 65, you need to meet the title, I think that's wrong. Is it Title 6? 16? I thought it was a different number. Anyway, those are the disability standards of the state if you're 55 to 64 years of age. And PACE can help you with this by talking you through it and helping you do the application process. Most PACE programs have somebody, especially the social worker, who can help you through this. All right, can we go to the next screen? So in PACE, enrollment is voluntary. When you meet with the team or the enrollment team, and then you come in and you visit the center and you meet the staff, you can decide if you want to do it or not. A PACE member must receive all of their services through the PACE program. PACE will set up what you need to receive, unless it's an emergency, and then you just go to the local emergency or dial 911, whatever that is. PACE does provide, PACE is at risk for itself. It's a self-insured program. And in PACE, these are things that are more outside of the scope of somebody who's looking for good care. This is just information that you should probably have. The state pays, and CMS, Medicare pays the PACE program at the beginning of the month to take care of that individual. So enrollment is a month-to-month thing. You can just stay in PACE as long as you want, but if you enroll in PACE, you stay for the month. If you don't want to be in PACE at the end of that month, you can disenroll. You can disenroll at any time. It's not restricted that way. And the conditions are that you have to go through that pre-admission screening, and PACE will help you figure out how to do that. And that screening, the PACE will submit into Mass Health's clinical team, and it gets reviewed there. And then you get a clinical eligibility notice that you actually are nursing home level of care and want to stay in the community. So we have the next screen. Oh, these are just some research studies. And Katie, you have this for people that you can post my PowerPoint so that anybody can review any of this stuff that you want. When you are comfortable and want to look at something and review things, this is a perfect place to look back. PACE has been proven, and it's a national program. There are 38 states who have PACE programs, and most of the PACE groups in Massachusetts do belong to a national group too. So they all work together, sharing information, new ways to care for people, innovative programs are coming up with. One of the PACE programs has these little, they're called avatars, but they're little screens, and on the screen is either a little puppy or a little kitten. So that if somebody is home alone, we have a few participants. Well, some of the programs have. One of them has 75 participants who actually utilize this avatar, and when they get lonely or they're a little angst or scared or have some kind of a panic attack, they can speak, and this avatar will respond. The avatar program is PACE pays for that, but they contract with a international program that actually has somebody live on the other end of that cat or dog who will help you or will contact the PACE program if there's something that's that needs the attention of the PACE program. Unless somebody just needs to talk to somebody, have a conversation, that the cat or the dog will do that. It's an adorable little program. I like it. But anyway, can I go to the next screen? So in Massachusetts, not every area is covered by a PACE program, like I explained. As you can see, the Cape and the Islands, the Berkshires don't have PACE. Framingham area, they're working on that, but we don't have PACE coverage there right now. So the areas that you'll see are where some of these PACE programs are, and we've listed the names of them under that too. But on the next few screens, I'll give you more information. Can we go to the next one? So on the next two screens are I've listed the 8 PACE programs, their contact phone numbers, and the addresses they live in. They can give you, when you call, a better idea of which area they cover. Like in Boston, there are 3. There's a neighborhood PACE, there's Harbor Health, and Upham's Corner. So, and they cover, some of them across, but some of them have different areas of the city of Boston that they will work in. And then we have 3 out in Springfield, different areas of Springfield, but we have 3 out there. One of them specializes in refugees and immigrants. They've been taking care of people who need those services for a while now, and they've done an incredible job with that. The next screen, can you show me? So these are the numbers. Mass Options is right there, Lynn. So if you go to the state, if you have a laptop and have access to the internet, you can go to mass.gov and look up PACE there. It will list all the information. It will also list links to all 8 of the PACE programs. But I've also put my email address down there too. And please feel free to contact me if you have any questions or concerns, something a little more personal than you want to share. Like with the PACE program, you can certainly call me and ask me. I have worked, like I said, like Katie said, for years. I've covered it in the state, and before that, I'm a dietitian. I worked in a few of the PACE programs, especially around the city of Boston, And so I know the ins and outs. I know how the teams work. I know what is provided and isn't provided. So what I just want to give you a little bit more information about finances. So it is a Mass Health program, and it's a CMS program. So in Massachusetts, it's one of the programs that Mass Health runs that you don't have to be a member of Mass Health to join, but there will be a fee. It's a monthly fee. All the services for PACE are provided once someone has paid that. There might be a cost sharing, and some of it might be paid by Mass Health. Some of it might be paid by the individual. So there are many ways someone can join and can pay for PACE if they are not Medicare and Mass Health eligible. I think that's probably all I have, unless somebody has some questions.
Liz, that is great. Thank you so much. You know, even I found myself, I'm like, oh, I forgot about the wide array of services. And
Oh, there are a lot, right?
I think that for people who have never talked with someone who's been a part of PACE before, or even for clinicians and providers, for them to understand about the PACE program so that they can say to families, you know, you might want to check this out. What I was really hearing from you is that PACE is there to help folks understand their eligibility and to help them figure out how they can complete their application and things of that nature. So that I don't want anybody who thinks, oh, maybe I could be a part of the PACE program, but I'm not sure, so I'm going to hold back. What I'm hearing from you is that the people who are connected with the program are passionate about it, and they want people to access the services.
And they do know how to help people
Right.
work with Mass Health, and they've been doing it since PACE has been around since the early 90s. So it's you know, it's grown and transitioned and along with the rest of the world, but in providing services. So I mean, the biggest thing about PACE is that it's medical, and it will provide, you know, it coordinates somebody's care so that even as a caregiver or as an individual on your own, you're not trying to figure out how you're going to get that dental appointment or to your cardiologist, or PACE does all of that for a participant.
It's so meaningful to me when I saw the graphic where you have the individual and their family at the center, and then the providers, and it goes out from there. And that person-centered care planning, from the families that I've worked with who've been a part of PACE, that's what I hear so much from them, that they feel that they can talk about their goals and their values, their goals of care, and that the PACE program can help them achieve those goals. Yeah.
Yes.
You know, I was sitting here listening to both of you and just thinking about how you clearly are so dedicated and knowledgeable about your work, and that working at such a high level, but really to know that that trickles down to the experiences that families have in the community. And I want to thank you both for bringing your passion and your expertise to our Community Forum Friday today.
Thank you, Katie.
Yeah,
This is a wonderful opportunity. Thank you.
Yeah, I think that I hope that this session inspires a caregiver or family member to just, you know, pick up the phone and find out what's in their local community, especially during the time of COVID. We want families to feel connected. And I think that the resources that you both presented today can help with that.
And can I just in terms of COVID, PACE centers have, you know, primarily closed. People are home, but they have brought in people who need to come into the center, whether it's for the day because they can't stay home alone or there's some medical issue. And some of them actually did step-down units. So when people were leaving the hospital, instead of going to a rehab, they could go to the step-down unit at one of the PACE centers. And the PACE centers, they were allowed family members to come in at that point. So a lot of people went home, and we did have some people who did pass in those step down, but it felt very close and very family oriented. So that it was been a very interesting time for everybody, especially the PACE programs.
Well, and I think so, you know, people should not assume that the programs are closed or that they can't access services. They should call Mass Options. They should call to find out about the PACE program. And again, I think the biggest take-home message is today to give that phone call, to find out what's available so that when the moment of crisis comes, you can already be connected with the Foundation for Support.
Agree.
I think
That's good.
so true, Katie. And Liz, I know that your PACE programs that you work with are very similar to the ASAP. They've been educating the folks that interact with them about COVID, how to be safe, what kind of mask to wear, making sure that individuals wash their hands. So whether you're receiving home care through a PACE program or home care through an ASAP, the staff have been trained. They understand and they know that safety is of the utmost importance for individuals and how to be safe. And they're trying to educate the community too, to make sure that the community, by and large, caregivers, elders, those with disabilities, understand how to be safe and protect themselves at this time. So it's really an opportunity to reach out and to even just ask some general questions on what's available, what's out there, what's true information from a reliable source.
Yes.
Exactly.
Well, I think that you guys have provided us with a wealth of information today, and I'm so happy that we are now going to have this as a resource on our YouTube channel so that in the future when people are asking me about these programs, I'll have something I can point them to that I feel is a bit easier to digest.
And then you can always refer them to me too, Kate, when, if it comes to that kind of a question.
That's right. We will be sure the slides will be included in the recording, and so people will have the contact information.
Great.
So Liz and Lynn, thank you both so much, and I hope you both stay safe and well.
Okay, thank
Be
you.
well. Thank you so much. Nice to spend Friday morning with you.
Bye.
Bye.